Hi, I'm Alan Hardin. I oversee performance, health, and wellness for Texas Athletics. We're in the north end zone this morning. We're going to take a tour of our sports medicine center. So come on in. This is the portion of our facility where much of the care of our student athletes is provided. We have 21 certified athletic trainers and 3 sports physical therapists that provide care daily to our student athletes. They're expert clinicians. They use blood flow restriction training, lasers, and other modalities to really provide the best care for our student athletes. A couple other techniques we use in treating soft tissue injuries, both acutely and in chronic pain, is cupping and trigger point dry needling, where you insert an acupuncture needle into a trigger point to reduce pain.
Instead of using a different instrument or a thumb for the soft tissue release, we'll use a needle in that fashion to get some blood flow to the area, some microcirculation.
So basically we're taking the tissue and we're expanding it so we can get some space within the tissue. And then from there, it creates a little bit more range of motion for the athlete to function. So it's kind of nice to have this as a nice tool for our athletes because they feel that they get a tremendous amount of benefit from it.
Here we have some of our state-of-the-art therapeutic rehab equipment, including our isokinetic dynamometer, our Ultra-G anti-gravity treadmill, and our functional leg press unit. This is our Ultra-G anti-gravity treadmill. It allows us to prescribe the amount of weight bearing that we want a student athlete to run with. It fills with air, you zip in, creates an airtight seal, and then lifts the student athlete off the treadmill so that we're able to gauge the weight they're putting on their extremities. This portion of our facility houses our aquatic therapy area. We have a state-of-the-art, high-speed treadmill aquatic therapy pool that can house up to 4 student athletes at once. So this HydroWorks pool is really unique in that the entire floor is a high-speed treadmill. It raises from ground level up to the top so that you can walk on. You'll notice there's no stairs and no ladder. So we can bring it up to ground level, student athletes can walk onto it. We can lower it down to the level of buoyancy that we want that's prescribed for their rehabilitation. We have private and semi-private treatment rooms where massage therapists and chiropractors who are on site daily treat our student athletes. One of the features of our sports medicine center is our physicians clinic. We have 2 full-time primary care sports medicine training team physicians, as well as a nurse and a paramedic medical tech provided by St. David's Healthcare that help meet the needs of our student athletes. Some of the services we provide are diagnostic musculoskeletal ultrasound, fluoroscopy, and many common procedures that are done routinely elsewhere.
By using ultrasound, we can do real-time images to get a functional status of a structure, and that helps us diagnose and get a rehab plan more quickly.
3 additional service lines that are housed in our wellness wing are performance nutrition, behavioral health, and sports science. Our behavioral health service line is comprised of 2 social workers who oversee both clinical behavioral health and our wellness and personal development area. They are integral to providing programming and resources to our student athletes that will not just help identify their athletic identity, but their personal identity. One of the time-saving features of our facility is that we have pharmacy deliver on-site so that many of the routine prescription medications are readily available. That concludes our behind-the-scenes tour of our North End Zone Sports Medicine facility. Thanks for joining us, and hook 'em horns.